In this video, we shall review the treatment pitfalls in acute pancreatitis. Acute pancreatitis is an inflammatory condition of the gland called pancreas that sits behind the stomach and is roughly located in this part of the body as drawn out in the cartoon drawing. When the pancreas becomes inflamed due to several causes, the commonest are gallstones and alcohol, it produces chemicals called cytokines. These spread throughout the body, causing inflammation. Pancreatitis is graded as mild or severe depending on the effect of the pancreatitis on the body. So now let's review the common pitfalls in management of acute pancreatitis. Acute mild pancreatitis is associated with a quicker recovery and does not cause failure in any of the organs such as low blood pressure, failing kidneys, or a low oxygen. These patients typically recover within a few days. Pain relief is often inadequate in patients with acute pancreatitis, and some doctors fail to recognize how difficult a condition it is for the patient. One of the effective ways of treating this is by way of PCA, or patient control analgesia, and to use opioids early in the treatment. The other common mistake is not to give enough fluid to the patient, fluid that is given through the vein to counter the effects of the chemicals or the cytokines that have spread from the pancreas itself. By not maintaining important parameters such as pulse, blood pressure, and oxygenation, patients may be prone to complications. Let's now look at the severe acute pancreatitis and pitfalls associated with that. It is important for patients with acute pancreatitis to undergo predictive scoring to assess whether or not they may develop severe acute pancreatitis that is associated with organ system failure. Patients with acute severe pancreatitis are generally quite sick. So let's review some of the problems with severe acute pancreatitis. As before, pain relief is often inadequate, and patients ought to be provided the appropriate pain relief medication by an experienced team that should include PCA and other painkillers. Often patients are not given enough crystalloid fluids. These are salt solutions that mirror the fluid within the body, and often the requirement for fluid in these patients is quite high to maintain physiological function of the body. An inexperienced team may not recognize the patients are severely ill and may not predict severity to be ready for the complications that may arise. And taken these two together, patients may not be monitored for deterioration adequately. These patients are often quite sick and they require monitoring of their physiological parameters such as pulse, blood pressure, oxygenation, temperature, but also blood tests and scans to keep one step ahead of the disease. And by not being able to do this appropriately when patients do deteriorate, they may not be deemed candidates or be moved to the intensive care unit early enough to try and support their physiology. Typically, deteriorating patients may require help with oxygen supply to the body or with low blood pressure or failing kidneys. Nutrition is a key part of treatment of severe acute pancreatitis, especially when the disease is prolonged beyond a few days. Replacing nutrition, whether through the gastrointestinal tract or artificially given through the vein, depending on the condition of the patient, is a key feature for most patients. Failure to maintain nutrition would almost inevitably result in deterioration of the patient. Failure to recognize infection is often a cause for concern because patients with acute pancreatitis will show markers, inflammatory markers that are elevated. And when these are elevated, they're often mistaken for inflammation rather than infection. However, experienced teams will take adequate action not to be sidetracked or mislabel patients. The infections may be intra-abdominal around the pancreas, within the pancreas, or in other places such as the chest. These severely ill patients may deteriorate. It is imperative that every time the patient shows any sign of deterioration that this is investigated promptly by way of blood tests and scans, and then to take prompt action. Patients are prone to developing infection, and these ought to be treated expeditiously depending on wherever they are, whether they are in the pancreas, around the pancreas, in the abdomen, in the chest, or in other places. Some part of pancreas may lose its blood supply and become dead. This is called necrotic pancreas. This is a fertile breeding ground for bacteria. And when it gets infected, the condition is called infected pancreatic necrosis. This is a deadly condition, and this requires expert treatment and removal of the dead pancreas if the patient is to survive. Finally and importantly, some of these patients may be sick for a very long time, and they would test the resolve of everyone caring for them, but mostly their own grit and determination to survive. Experienced units and clinicians are aware of the long haul and how important it is to keep on top of this deadly disease, mainly because once patients recover, they may have a good quality of life long term and return to normal living. I hope you found this of use. If there are any comments, please do share.